I'm absolutely delighted to be able to introduce to you an absolutely phenomenal human being. Someone who, whether you know it or not, could actually be a fantastic personal coach for you regarding career issues. I don't know if Dr. Tettey has thought about such coaching for individuals who need assistance with their careers, but she really needs to start that consultation business, pardon me. So I am absolutely delighted to say that she is a graduate of our doctoral program here at Teachers College. She served for over a year as one of the leaders, close those doors, Eric, as one of the leaders of our research group in Disparities in Health Alumni Association, and that she is a newly hired assistant professor at William Patterson University in New Jersey. So without further ado, I'd like to introduce to you Dr. Tettey.
Okay, good afternoon, everyone. Okay, so my talk today is called The Innovative Use of Media to Educate Public and Community Health Students About Health Disparities, Social Justice, and the School-to-Prison Pipeline, using the HBO series The Wire in Teaching the Social Ecological Model. The goals of my talk are to discuss the need for innovation in pedagogy in community health and public health education programs, highlight the value of using The Wire as a teaching tool in public health courses, share student reactions to learning through The Wire, and provide recommendations for improved pedagogy through the use of media. So public health faculty, academics, and researchers have been given a call to action. We have been asked to come up with more innovative ways to reach students and to engage students. There is a need to re-energize public health education through innovative pedagogy, which is the method and practice of teaching. It is time to start thinking out of the box to fully engage students. We must place more emphasis on education for the purpose of social change. We must open young minds to novel possibilities and at least ensure that when they encounter some uncomfortably disruptive new idea, they will give it the respectful consideration that it is due. Curricular innovation is essential if we are going to meet the needs of educating the next generation of public health leaders in both quantity and quality. According to the 2003 Institute of Medicine report, schools and programs of public health should emphasize the importance and centrality of using an ecological approach. One way to create this innovation is to change how we view the use of media in the classroom. Using media such as films, music, or song clips in classrooms is not a novel idea. Using media engages students, aids student retention of knowledge, motivates interest in the subject matter, and illustrates the relevance of many concepts. However, on the surface, not all media is viewed the same for use as a teaching tool. For example, many public health academics are familiar with and have used such titles as Unnatural Causes, Sick Around the World, and When the Levees Broke. However, shows like The Wire, The Corner, and more recently, Money and Violence are not conventional or popular choices. The focus of this talk will be on the effectiveness of The Wire as a teaching tool. The Wire is an American crime drama television series originally broadcast by HBO, set and produced in and around Baltimore, Maryland. Each season of The Wire introduces a different institution in the city of Baltimore, including the illegal drug trade, the seaport system, the city government and bureaucracy, the school system, and the print news media. The show's creator, David Simon, states that despite its presentation as a crime drama, The show is really about the American city and how we live together. It's about how institutions have an effect on individuals. He goes on to say that there are two Americas, separate, unequal, and no longer acknowledging each other except on the barest cultural terms. In the one nation, new millionaires are minted every day. In the other, human beings no longer necessary to our economy, to our society, are being devalued and destroyed. First appearing on HBO in 2002, The Wire has been called the best show on television, the best TV show ever broadcast in America, and the closest that moving pictures have come so far to the depth and nuance of the novel. The Wire has been the focus of academic conferences, special issues of journals, and essay anthologies. Although it could be considered a cop show, The Wire is not Law and Order or 48 Hours. It is more than just a cop show. So what makes The Wire different? Instead of just showing a crime and the pursuit of the criminal, as most cop shows do, The Wire takes the viewer a step further to exploring what caused this crime and the other pathogenic conditions shown on the screen. Instead of just portraying the what of a story, The Wire explores the why and the how also. The Wire focuses on the contributing factors such as poverty, racial discrimination, and institutional collapse, the socioeconomic conditions that give rise to criminal activity. The intention of The Wire's creator, David Simon, was to give a vivid view into what he has called the other America. From a public health perspective, The Wire explores the social determinants of health in detail and also utilizes a social ecological approach by examining the individual, interpersonal, organizational, community, and policy levels of causation. Universities such as Harvard and Duke have developed courses based on The Wire. What is important to note is that many of the programs and courses that The Wire has been used in are in disciplines such as criminal justice, urban politics, education, philosophy, and social work. Although the subject matter is pertinent and relevant to these disciplines, it is clear that the content of The Wire would fit directly with public health programs and courses. My premise is that The Wire holds great pedagogical potential for academics in public health. The Wire clearly demonstrates many interconnections, intersections, and collisions between the educational, political, social, and community storylines. It does this in a way that will challenge students and also engage them. There is limited research that assesses the effectiveness of The Wire as a teaching tool or media text. The majority of this research is from the perspective of the instructor and not the student. Therefore, to examine the student perspective, as well as the effectiveness of The Wire in a public health course, a pilot study was conducted using Season 4 of The Wire. Students from 2 public health courses at 2 different universities in New Jersey were used for this study. The first university is located in an urban setting in New Jersey with a majority middle to lower income student population. The second university is located in an upper middle class area of New Jersey, with students being more middle to upper income. For both classes, 60% of the students were Caucasian, 20% African American, 10% Hispanic, and 10% other. Season 4 of The Wire was used because of its clear illustration of the social ecological model and the social determinants of health with the Baltimore education system as the backdrop. Although many of the characters from prior seasons are present in this season, 4 new characters are introduced and serve as the main storyline. Each character represents a high level of complexity that gives students a chance to view issues presented from various perspectives. So those characters were Randy, Michael, Namond, and Duquan. The course in University A was titled Disparities in Health, and the course in University B was titled Health Disparities and Social Justice. Both of these courses are required for public health majors and can also be taken by students outside of the major. During the fall 2014 semester, students were given a choice for their final paper assignment. For the first option, students had to choose a health issue and a population that represented a disparity for the health issue. Students then had to use the social ecological model to determine and analyze the contributing factors for this disparity, including individual, interpersonal, organizational, community, and policy levels. Finally, students were asked to create an intervention at the level of the social ecological model that they believed, based on their research, was the largest contributing factor. The second assignment option that students were given was to watch season 4 of The Wire. After viewing, students were to choose a character, preferably one of the main characters, from that season and conduct an analysis of that character, again using the social ecological model. Finally, students were to determine the largest contributing factor to that individual's life and also propose an intervention based on that level of the social ecological model. The number of students completing each assignment at the two universities was almost equal. At University A, there were 15 students who completed The Wire and 14 who did the regular health disparity paper. At University B, there were 13 students who completed The Wire and 18 who did the regular paper. At the end of the semester, focus groups were conducted with both groups of students. For the students who chose assignment 1 and completed the analysis of a health issue but did not watch The Wire, they found the assignment to be interesting. They were able to learn information regarding the various contributing factors of a disease, and they were also able to learn about health disparities. However, for many of them, it was just another assignment or paper to complete. For the students who chose to watch The Wire, the assignment seemed almost life-changing. The majority had never watched the series before. Student focus group responses were organized into 4 themes: experience watching season 4 of The Wire, exploring the social determinants of health through watching season 4 of The Wire, learning the social ecological model through watching season 4 of The Wire, and student perspectives on The Wire as a teaching tool. The focus group showed that a media text such as The Wire provided a highly engaging experience for students. Initially, many students could not handle what they were viewing, and students would come to class often looking disturbed by what they had seen on a particular episode. And as a professor, I could tell when the students had started watching the series because you can see their whole affect would change when they were in class, and they just looked very disturbed. Students had to watch the series on their own and had to complete it by a certain date. Students use words to describe their experience, such as overwhelming, powerful, upsetting, and eye-opening. Some students even shared that they found themselves crying and feeling deeply saddened the more episodes they watched. Students also stated that they could not believe what they were viewing was actually occurring in the United States. For many of the Caucasian students, and as well as the more affluent students, there were comments made to reflect that they had never given deeper thought to the various social justice issues presented in this series. And this is an important point to note because even though they had taken health disparities courses and social justice courses, they had taken them in the context of taking a class, but they never really thought much deeper about the contents that they were learning about. They had learned them and studied them for the purpose of taking a test, but they never internalized the information prior to watching The Wire. These students knew of neighborhoods that were similar to those presented in The Wire, but they never gave them much thought. They never gave much thought to who lives there or what their lives are like. There was no humanity, just a labeling and a single story such as those people, bad neighborhood, or the ghetto. Through watching The Wire, they were able to see that those people had hopes and dreams, laughed and cried, loved and lost, and deserved just as much of a chance at life as they did. Students stated that they can read a statistic about high crime rates, concentrated poverty, and poor schools, but to see how this manifests and have consequences on many levels is what truly had an impact on them. So even looking at the 2 pictures that are presented here, the top picture shows the characters that are based on season 4 in The Wire, just having a normal day in school, something that most students could relate to. But then the bottom shows what happens when they go home and the decisions that they have to make based on the communities that they live in. And that stark contrast was something that was difficult for students to grasp. The main social determinants of health explored in season 4 of The Wire are education, economic stability, neighborhood and built environment, social and community resources, family structure, health, and health care. One of the main storylines of season 4 involves a former white police detective named Roland Prosbeluski, known to everyone as Prez. Prez is introduced in season 1 as an inept police officer, And at the end of season 3, Prez has resigned from the police force, but in season 4, he resurfaces in the first episode to apply to be a teacher at Tillman Middle School on Baltimore's West Side. On his 2-minute job interview, Prez explains that he has a temporary teacher's license and he used to be a Baltimore police officer. He is hired on the spot, which begins his teaching career. And I'm just going to share that clip with you.
Total of 54.
No surprises on who's coming back, all the regulars. We lost Mr. Parker and Miss Bowles.
Gregory's leaving?
Hired by the county. And Bowles, I knew she wasn't coming back the way they tore up her classroom. So we're short 2 in math and 4 in science.
Man at the door, no system ID, but says he's new here.
Well, buzz him in before something changes his mind.
All the way on the left. Pull it hard. Hard. All right, I'll be right down. Not a goddamn thing up in here works like it should.
But you turn to the cafeteria assignments and you see that's going to leave Ernest alone for second period, and he can't handle it alone.
You tell him, because I ain't even going to try to pronounce it.
Roland Prez-Belusky? Everyone just calls me Prez.
Well, no, Withers. I'm principal here.
New in math.
I won't have my certificate until next year. But with the resident teachers program, they said I'd be getting classes because of staff shortages.
Jesus, lambs to the slaughter here.
What did you do before you decided to teach Mr. Prez-Belusky?
I was a police in the city.
Marcia Donnelly, assistant principal. Welcome to Edward Tillman Middle.
Which leaves us a total of 54.
Okay, so that scene in and of itself, just being even 1 minute long, has so much substance in it for students to reflect on. So one thing that students noticed was the haphazard way in which Mr. Prez-Belusky was even hired. So that was his entire job interview, that 1 minute, and the fact that he had prior experience in the police system is what qualified him to be a teacher. There's one statement in that scene where the secretary says, "Nothing in this place works as it should." And that statement is taken through the entire season 4 to show how the education system is so broken down, but furthermore to allow students to see the connection between that and also the lack of future prospects for the students who attend that school. So students were able to view what happens with a broken educational system where not all teachers are of good quality. There is a shortage of teachers. Teachers are forced to teach to the test. There is social promotion, no textbooks, and no resources available to effectively deal with the various problems that the students present with. Students stated that they could not imagine having to learn in this environment and that there was no way that someone who had to learn in this way could be expected to thrive. Students stated that they were able to make the connection between poor education systems, lack of employment options, and high incarceration rates. One statement that stayed with them was when the secretary stated, "Not a thing in here works the way it should." The Wire is excellent at showing connections between events and context. Nothing occurs in isolation. There are root causes. Season 4 focuses on the relationship between poverty, racial discrimination, and institutional collapse, and the socioeconomic conditions that give rise to the criminal activity. Students stated that the social ecological model was clearer to them after watching The Wire. Oftentimes when teaching a health disparities or social justice class, it is difficult for some students to understand why the solutions are so complicated. So for example, when talking about food deserts, I've had students say to me, "Why don't the people just get on a bus and go to Whole Foods and buy fruits and vegetables and bring it back to wherever they live?" So to the students who have not lived in certain environments, who have not seen it firsthand, it's very abstract when we talk about urban blight or food deserts or any of these concepts that we teach in these courses, broken school systems. But when you show something like The Wire, students are able to at least have a visual image of what this looks like, what it's like to experience this on a day-to-day basis. Students also stated that there was constant negative pileup from so many directions that made it almost impossible to break the cycle of poverty. Students shared that in courses that deal with complex subject matter such as poverty, systematic injustice, health disparities, and racism, they may understand the concepts in a superficial or intellectual way, but they are not connected to it. Many have not lived it, therefore there is a lack of a deeper level of empathy, compassion, and desire to make a difference. Watching The Wire allows students to get closer to the various issues that are discussed in public health courses. Although The Wire is a television show, students know that these individuals and situations exist. One student shared, "I had to take a break from watching so many times. I always wanted the story to end well, but I knew it wouldn't, and I could not handle that because I came to realize that someone was living these same experiences right now, not too far from where I am." After watching season 4, there was an urgency in students to want to make a difference. Students also noted that pairing episodes of the series with selected readings would be the most effective way to use The Wire in the classroom. In terms of future directions, The Wire gives a vivid view of what has been called the other America, the America that has been minimized to terms such as underserved, underprivileged, and low income. When discussing and reading about health disparities and social justice, students who have not lived certain experience believe that the answers are simple, similar to the example I just gave you about the food desert. However, providing a clear image along with the text and discussion allows for greater understanding of why the solutions are not that simple. For instructors in public health and community health education, programs all 5 seasons of The Wire provide rich material for course content. However, the point is not just to use The Wire in the classroom, but to use teaching tools that will stimulate students to action and to social change. For example, after students watch The Wire or a similar program, they are ready to take action. This would be a great time to then have a service learning or community service course or assignment attached to the viewing of The Wire. At the end of season 4, there is a scene between one of the characters named Duquan and one of the more positive role models named Coach Cuddy. And in this scene, Duquan is asking Coach Cuddy, what are his options for the future? He is saying that all he sees in front of him is standing on the corner and selling drugs or being killed. And so Coach Cuddy shares with him that there are other things beyond the corner. And so I'm just going to share that clip with you.
People around the way gonna leave you be. Thing is, even if you learn to fight, people gonna come at you just the same. Ain't like the movies where you beat up one bully and the rest just back the hell up. Let me ask you, why you think they even bother to come at you the way they do? I mean, why you? See, all I know is that right there. I ain't never had no use for other things. I could fight. For a time there, I could run them corners. Not much life outside of that, really.
I was on the corner for a while.
How'd that go? Yeah. Well, I guess what I'm trying to say is, not everything comes down to how you carry it in the street. I mean, it do come down to that if you're gonna be in the street. That ain't the only way to be.
Well, here it is.
Yeah. Now here it is. The world is bigger than that. At least that's what they tell me.
Like, how do you get from here to the rest of the world?
I wish I knew.
So in closing, I think that the goal and the purpose and intention of public health educators should be to help our students think about that question. how do people get from there to the rest of the world? And so by using innovation in teaching, using series such as The Wire and others that are similar, we can get students excited about learning, excited about the subject matter, but more so excited about serving and making a difference. Thank you.
Hello. We have probably now 3.5 minutes for questions. So who has a question? Meanwhile, I want to thank you for being my inspiration to continue to teach, because every once in a while you have a pure diamond in the bunch.
Thank you.
So how many times have you done this?
Well, let me start by saying I watched The Wire myself maybe 2 years ago, and it just completely changed me. I've never seen anything like that before, and I thought to myself, are people using this in the classroom because it's perfect? And I Googled it, and that's when I saw that it wasn't being used as much in public health. So I decided to use it last semester for the first time in the fall, and it was an option for students to do one assignment over the other. This semester I'm using it, but they have to watch it, so everyone has to watch it. It's not a choice anymore.
And so how's that going?
I'm seeing their faces and the discomfort, and that I can't get through this. It's starting, but I'll let you know next year.
Well, you also have this master's degree in clinical psychology. So I'm wondering if you have thought about even devoting 10 minutes of the class for emotional processing of what they're going through. Does that occur at all?
Yeah, we do that. So as the students are watching it, what I did last semester was have conversations with them about what they're feeling, why are they feeling that, what's coming up for them. So we do have processing. It was a little bit more difficult if anyone is thinking to do this when half the class is doing it and half the class is not, because the other students don't know what we're talking about when we're having the dialogue. So that's why I thought it would be better to have everyone doing it. But we do have that processing time while they're watching it.
So have you also been able to discuss in the class potential answers to that question? How do we get from that kind of situation? How do we take social action for social justice on behalf of those so that they can get to where they like to go? Have you discussed that also? What's that been like?
Yes, we do. And being that the schools where I teach are in New Jersey, a lot of the students after the fact will look up different organizations that they can volunteer with, look at different organizations and see what they are doing in the community and see how they can help as well as thinking about ways that they can stop thinking of certain communities as the other. So I think just starting at that point, and even that is a lot to absorb for certain students, how for so long it was kind of like invisible people around them, and now they cannot think of them as invisible anymore. And so that's the starting point. But yes, students do start community service a lot do after that.
Okay, let's give her another hand. Okay, so for those of you who are doing the chess evaluation forms, you will note that we went a little bit out of order. But we are absolutely delighted that we do have our next presenter here, who got here about 3 minutes late, and boy, was I glad to see her. So that's why we're out of order. But without further ado, we can now have our talk by Dr. Jameelah Rashid. And please read her extensive bio. We're absolutely delighted that she's here and that she will share with us her knowledge and expertise, which is wide-ranging. Thank you.
Oh, I'll just start by telling you I am exhausted. I got up at about 4 o'clock this morning, and I didn't get here until like, I don't know, 1 o'clock this afternoon. Okay. And I've had nothing to eat on top of it. So my energy's a little bit down, and I may be a little disoriented. Anyway, I am now currently the executive director of the Urban Health Program in Chicago, Illinois. I'm originally from Chicago. However, I spent the last 18 years until a year ago lollygagging around the country, working at the Centers for Disease Control and Prevention and in HHS, Office of Minority Health, where I did a lot of things that I'm proud of. And then somehow last year, someone called and twisted my arm and told me I should apply for this position, which I did. And I, of course, got the position. And I'm still working through some challenges of taking over this really great program that has done a lot of good for minorities, especially those who maybe don't necessarily come from a family structure that was intended for them to become doctors and nurses and dentists and pharmacists. Possibly some of them came from families that, if not for this program, they could have ended up just being general workers in the factory, possibly, some also making it out in spite of themselves and what was around them, but a lot of them would not have made it. I'm actually one of those who kind of snuck through. Despite my own circumstances, I initially lived in a home with my father and mother and 9 kids, and he had like a 3rd grade education, but took himself back to school, became an engineer, injured his back. They told him to go on welfare, and he said no. Not me and not my kids. And so we lived in 2 rooms of that house for a good long time. I remember my brother taking potato skins out of the off the table after my mother made mashed potatoes, and he made him some potato chips, and he wouldn't let me have any. But over time, my father, went back to school, got his bachelor's degree, moved us to Chicago. And when we got out of that car and I looked up at that big, tall building, I thought we had died and gone to heaven. Guess where we were? Cabrini Green Projects. But it seemed like heaven to us at the time, until a couple of kids threatened to beat my butt and had me scared to go to school. But we eventually moved on from there too, and moved into a home. And my father ended up working for Martin Marietta and Boeing Jet. He actually worked on the space shuttle project. So it just goes to show that through education, it can change lives. And so it was kind of an honor to me and a challenge, because it's not easy, to go back to the University of Illinois, where I actually graduated, did my MPH and Ph.D. work there, and take over this program, which is basically a pipeline program to recruit underrepresented minorities, Hispanic, Latino, African American, Native American students throughout the city of Chicago and Illinois to bring them on campus. We start at kindergarten during the summer through 12th grade, and we provide students enrichment to help them strengthen their math and science skills and language skills. And then during the school year, we bring them in from 5th grade on Saturdays and do the same. And we have a special ACT prep program for high school juniors and seniors to make sure that they can get the type of ACT score that people would look at and say, wow, I want this student at my school. But the program really started in the mid-70s, and it was the brainstorm of community activists and other leaders and some students who felt that the university needed to do more to make sure that minorities could get into the school and go through the program. So state legislatures, community advocates went to the state legislature and made the case that in order for us to, in Illinois, to ensure that the residents of Illinois have adequate health care and have the kind of workforce that's needed to take care of the health needs of its citizens, that it needed to do more to prepare minorities to be those healthcare workers, because they're the ones that's more likely going to come back to the communities that they lived in and serve those citizens. And so it was convincing enough that the state said, well, let's give it a shot, and they started with just medicine. And after the trial run with medicine, there was enough data and evidence to say, yep, this is probably a good idea. And then they expanded the program, and so it now includes dentistry, medicine, nursing, allied health professions, which is people who want to be therapists, physical therapists, other types of allied care givers. And then it started with a few of those schools, and then as the program showed its worth, other disciplines would come and say, hey, what about us? You didn't include us. So that's how public health was added to the program a few years later. And so it's been going on for like over 35 years, and we at the University of Illinois, which is not a school that's predominantly African American, Hispanic, Latino, or anything like that. It's a general school. There are a good number of Caucasian, and we are even right now increasing our enrollment of Asian Americans, and the University of Illinois just became a Hispanic serving institution as well. So it's, has a good, number of mix of populations there at this time. So because of that, because of the work that was done, because of the push by not just state legislatures, even Congressman Danny Davis, who is a federal congressman, was a strong supporter of this program and was on what's called our Community Advisory Committee in the early days of the creation of this program. But all of these various entities can really brag and feel proud about what they did, because it was not easy. It was a struggle initially. Many did not want to do this. They didn't see that it was needed, and we had to show that it was needed. And so because of that, we can boast that the University of Illinois, outside of predominantly African American institutions such as Morehouse and those others, we have graduated over 6,000 health minorities in the health professions, and it's only probably second to one other major college university. So we think that's quite an accomplishment. Now, how do you move these slides? Oh, this thing? Okay, let's see. Did I go the wrong way? Yep. Ah, okay. And I can't really see this stuff. I'm used to a big screen. I'm blind. Yeah, I can't see that one either. That's another thing my father did for me. He made sure I couldn't see well. Okay, so this just tells you, so fast forward to now, this program has, like I said, been in place for like 35 years. But just to give you a sense of what Chicago looks like now, and it's kind of a image of, to some extent, what our population inside the university may look like as well. As you can see that as in the United States, that Hispanic populations are growing at a fairly fast rate, and they've surpassed African Americans nationally. They have not yet, though, surpassed African Americans in the city of Chicago, although they have in the state of Illinois. Yet, I don't have this data in this presentation. As I just said, we're now becoming a Hispanic serving institution. That in itself should indicate to you that they outnumber African Americans at the University of Illinois. But all populations, all of these underrepresented populations are part of the urban health program. So although there, with one exception, there is a Hispanic Center for Excellence at the University of Illinois that only focuses on medicine, and it has a special program just for Latinos. However, all the other disciplines of your health professions are part of the program that I lead. And this just gives you some framework of what things are going to look like in the future. And so, because the underrepresented minority populations are growing, that there is a great need to continue to build programs such as the Urban Health Program, to be able to ensure that we provide students from these populations the support that they need in order to matriculate through whatever program at the university they choose to do, especially those that are focused on a career in the health professions. That's basically what we do. As I said, we start at very young age, and we work with them through the process. So even though students come into the university as undergraduate students, and they have this desire to be nurses and doctors, as undergrads, one of the aspects of the central office that I run is that we try to grab those students as soon as they come in the door, so that they don't end up slipping through the crack, that they don't end up failing classes and not having anyone to go to help them. We identify them and we track them, and we make sure we're there to help them before they start slipping up, so that they actually don't end up having to slip up. Provide them with tutoring and financial support to the extent that is needed and possible. Mentors. We keep track of every student that ever was in the program, and we reach back to those individuals. They could be now have their own practice somewhere in physical therapy or medicine, or be practicing in a local hospital or clinic, and we still know where they are, and we reach back to them so that we can have them mentor our students who want to follow in their footsteps. So I've already touched a little bit on the history of the program, and I want to, especially in light of the time, I want to just move to one of the ways that we are supporting our students in the program. Is that this just gives you some sense of the degrees. I've already talked to you and mentioned how we have, as a non-minority institution, have been very successful at graduating students in the health professions. And this has been a trend over the years. And as you can see, even in the last couple of years, the numbers are even increasing more. So, of course, there are challenges to our program. Recruiting students into certain programs with the colleges is a challenge. And so we have to work with the students within our office to make sure we understand what is it that they need in order to get into that program, and how can we help them with that. Because once they get to the college's focus is on keeping them in that college and not losing them once they arrive there. But it's our job in the central office to help make sure they get there. And so, in addition, what we try to do in our office is also ground the students in community health, community practice, in developing that desire within them to want to give back, to want to help. We're not looking for students who just want to go to medical school because they want to make $500,000 a year. We're really trying to focus on students that we can get to buy into the message, to develop the passion for helping others from their community to have access to quality health care. So if they're going through the program and their hope is to run off to California and open up a big, facial correction clinic, I mean, of course, that's their prerogative to do so, but that's not why we're doing this program. We're doing this program so that they can go into the professions that will help to eliminate disparities in our populations. And so if I can move on and talk about a program that actually started, is a result of work that I did in the federal government. Through the comparative effectiveness research funding that was included in federal legislation under the Obama administration, I was awarded several $1 million while I was working at the Office of Minority Health. And I used that funding to work with the University of Illinois and a school in Houston to demonstrate that patient and community engagement can have an impact on whether or not individuals with diabetes and hypertension and other types of health problems can improve their self-management of their disease through a community engaged process. And so this was something that I saw as an opportunity as well to ground students in this kind of work, so that it could possibly increase the likelihood that when they finish, they will think about work that allows them to do more of that, and not just about just getting a position somewhere where they're going to make a lot of money. But go ahead and make a lot of money, but also make money helping others. And where's there a better need to help others than in communities like those that you came from? And so through this program, we were able to utilize students in the urban health program to work, to be those students that would work in the clinics, with the patients, providing them this kind of care. And so this just, gives you kind of a more of a bulleted understanding of what I just said. And as I said, it was done with the School of Public Health and students in allied health at the university. We trained them. We involved the faculty and other academic staff and advisors to work with them to provide them the guidance and the foundation that they needed to go into clinics, community health centers in Chicago and in Houston to do this kind of work. And once we completed the work, teaching patients how to monitor their blood pressure, how to, check their glucose, how to prepare meals that were healthier for them than what they normally would eat, and how to make it tasty, and also exercising. And there were other ramifications from this, in that some of the students who participated, as well as the patients, once they've completed the program and they had learned how to cook food that was tasty but more healthy, a couple of them went back to their churches and started applying that way of cooking in their churches. And the ministers were very impressed with it, and some of them made it part of their regular meals to prepare dinners that were less salty, not always fried food, more green vegetables. And so, those were some of the lessons that not only the students learned, but even the patients got out of participating in this program. This just, gives you a sense of what some of the goals of the program were, that we wanted to reduce the A1C and weight of the patients, and we wanted to create behavior change. And through some of our assessments that we did post-intervention, we know that, as I said, many of the patients did make those changes, and many of them are sustaining those changes. Of course, we don't have the funding anymore, so we can't go back and necessarily do all we would want to do, or engage the students in doing some of this work where they might follow up with some of these patients. However, as a result of this work, it was selected to go into the AHRQ online database of effective interventions, promising interventions, and now we're working with the health center in Chicago to utilize our students to go back and do more of this work. And we're hoping to get some funding so that we can do it on a wider scale, because it's really important that students get this early on experience. I know as myself, when I started going through completing my public health degree and my MPH and Ph.D., that it was the work I was doing in the communities that really turned my eye and my heart towards that kind of work, and the reason why I'm doing it now today. So it's important that students not just go through school, focused on making sure they just get the grades. Yes, you need those grades, taking all the right courses, and then coming out of school and not really having a good perspective of now, what are you going to do to give back? Some folks sacrificed so that you could have that opportunity, and you have your degree now. Do you take it and just run off with it, make a lot of money, go on a lot of trips, have a good time, have your family, or do you do that and find ways to give back for the sacrifices that someone gave to you? And that's really why I'm where I'm at today. I know that people helped me to get to where I am. I didn't do it all by myself. Yes, I struggled and I went through some things, but I know that at times, especially when I needed someone that was there to help me, several times someone made sure I got a tuition waiver, because I didn't know where I was going to get the tuition to pay for my degree, my classes for that semester. And so by doing that, it makes me want to do that for others. And so that's the kind of, we want health professionals, want doctors, nurses, dentists, so forth. We want them to be those that want to give back. One of the activities I recently made my staff do, and they didn't want to do it, but I believed in it. I said, let's have a speed networking event. I want you to go in the database and invite the doctors and nurses and whatever. Yes, they're in their practices, but I believe they'll come. And they did that. And they came in like from 50 miles away on 7 o'clock in the evening on like a Monday and sat at the tables with our students. And each student had the opportunity to speak with each one of them because we, had them sit there for 10 minutes and then we moved them. We fed them too, so they weren't hungry. That's one thing that we realized we must do in Chicago is we got to feed people and we got to, take care of their basic needs in order to keep them at the table. But it was a great event, and so we know that through keeping in touch with our alumni that we're able to serve our students better because they provide examples for who they want to be. I believe that's my last slide. Well, no, but I think I've probably touched on what I really wanted to indicate, and that is the real need to ground students in what they're doing and in what's behind why it's so important that they make the choices that they make, that they take on the careers that they want to take on, and that they always see themselves as part of a continuum and not just, I'm here to get my degree and then get out there and make mine, which is something that happens in some of our communities just too often, that it's about me and getting mine. But we wouldn't be here where we are today if someone did not say, that's not enough. I've also got to reach back and make sure someone else gets a leg up, gets an opportunity, just as I had. So I want to thank you for your time.
No, we want to thank you for your time since 4 o'clock this morning, making sure that you were here. Let's give Dr. Rashid another hand.
Thank you. Thank you.
We almost had time for one question. So I think I just want to make a comment and do a commercial that, having done outstanding service to the government, our nation, through the CDC, you should know that Dr. Rashid and some of her colleagues have a chapter that came out of one of the earlier annual Health Disparities conferences. So that's the edited volume toward equity in health, a global approach to health disparities, which does an excellent job of really capturing the kind of integrated systems that are needed to address health disparities. So again, we really appreciate all that you did to get here. Thank you so much.
Thank you.